This video is for the truly advanced medical assistant. So I'd like to point out a few things once you know how to do a follow-up and a new patient. Let's say this patient has been seen once before and we're going into the HPI. The HPI, when we copy it over, is going to have this verbiage. This is a new consult. Typically, the flow is that, or the order is that they'll have a new patient visit, and then they'll have an EMG, and then they'll have a follow-up. And once you get to the follow-up, we no longer want this is a new consult. So we're actually going to Control-Alt-Delete that, and we're going to search for a controlled follow-up, and that is the third from the bottom. And then you'll also go down to back pain and whatever else is applicable, maybe neck pain, maybe knee pain. So this patient prevents for chronic evaluation. That would be what we want to do. Now, most won't do that. Most will just copy over the new patient and the provider will fix it. But it is helpful if you do recognize this is no longer a new patient to update that HPI rather than just copying it over. And then same with the physical, rather than just copying it over, if this is the second office visit, then you'll actually want to search for the exam follow-up rather than copying over the new exam from last time. And with the assessment as well, this one I think is the most tricky because you just want to delete a piece of it, and it's easier to delete it if you expand it. So I'm going to click on the magnifying glass to expand it, and I want to delete everything below this number, this severe depression number. Up until the line. So there should be a line eventually. Sometimes it's hard. There, see, there's the line. So I'm going to delete all of that. And I'm going to add, by going back to my magnifying glass and looking, a Kundi follow-up. And hit OK. And then, as you'll notice, it copies in these scores twice. So I'm going to delete these scores. So just down to that depression again. And in addition to having too much on the top, it also doubles on the bottom. So you'll see the plan, and the plan will just delete between these two lines. And instead of putting plan, we'll put tests. And that is how you do the next follow-up. I think I'm going to save this video as a provider video because it's more relevant to providers. Another thing is inpatient register that you can look at. Of course, you can look at their schedule and see when they're scheduled next, what their schedules have been. You can even print this off if they want like their whole injection history. Typically, they'll have a long list of injection visits, so you can print that off for them. And if you want to look at their insurance, that's going to be this little insurance tab. If you do need to, save their license and insurance for any reason, then you can go here and hit the print button and save it as a PDF. And you can, this would be their license, so you'd go to this print button and save as a PDF. That's primarily for ordering intrathecal medication. And if you want to look at their pharmacy, you can go here and you can add a preferred pharmacy. We're going to go to the CVS in Brownsburg. I wonder if I can just do it like that. I can't, because I can't tell what Brownsburg it is. So I'm going to expand this and do the CVS in Brownsburg, Indiana. There should only be one. Oh, there's a second one now. Okay, well, I'm doing the one on Main Street. And so now they've got their preferred pharmacy. Typically this will be done by the front desk, but sometimes the patient changes it in their room, which is fine. So now they've got their preferred pharmacy. And if you want to delete one, go over here and delete it. Because let's say they had an old Kroger in there from California and you don't want that. And we don't send medicines out of state, but either way, I'm going to delete California Kroger. And those are the three main things. So we've got our insurance over here, our appointment schedules over here, and our insurance over here. If you want to help them update their login for their website, they do have to have a email entered. They don't have to, but it's weird if they don't. So just make sure you give them their email, zzz@gmail.com. And then they have to give you their email. And then their user ID is usually the first three of their last name and then some of their first name. But this one looks weird, but usually it's like Smith A. And then the password does have to have a letter in it. So I always just put 1, Smith A1. You don't have to set up the password for them. They can do it, but I just do it for them. It's faster. So just add a 1 after their user and give them that information so that they can now log in. So this says email ID is blank. Oh, okay. Well, hang on. It shouldn't be blank now that I've added that. Well, it's still blank. Either way, that's how you would help them with the login. This is just an example, so it's not letting me do it right now. And again, whenever you update something and you hit save here, it'll say, do you want to do all of this? If you hit yes, then you have to go through and do all of that. Just hit no, and it'll quickly save what you just did. Like I just added his email. And of course, messages are right here. If you want to search for a patient, you can do that here. Or if you're already in patient register, you can also do that down here. And if you want to write a message about a patient, if you click here, that automatically starts writing the message about the patient's chart that I'm in. If you don't want it to go in the chart, then just clear their name. Or you could also just uncheck add to patient medical records. So ZZZ, I don't want it to be in his chart, so I'm not going to add it. But I do want someone to know that I'm talking about him. So I'm going to send this to Susan, and it's going to be about his PA because she does the PAs. Usually I'll put their insurance, like UHC, and then I'll put the medicine, PERC stands QID. And she doesn't need any more information than that typically. I can attach something from the chart if I need to, but that's almost never necessary. If you did want to message a patient, you can go to patients and search for that patient. But typically we're always just messaging clinic users. And yeah, I think the biggest helpful thing is if you want it to be in the record, check this box. If you don't, uncheck this box. If it's not related to this patient, you can clear this and you can search another patient, or you can just leave it blank if it's not about anyone specifically. I'm not going to send that, so I'm just going to go ahead and cancel. Another thing with messages is if you check urgent and you send it to someone, like if I send this to myself and urgent message, patient dying, then what happens is it should pop up. An urgent message sent to me should pop up, but it's not popping up right now. I don't know if it's because I sent it to myself, but that's what happens when you send an urgent message. It'll pop up even without them going into their messages. And that is pretty much everything that's useful through here. You can log out using this. There it goes. Urgent message, patient dying. So that's how that works. If you don't send it urgently, it'll just go to their inbox and they'll see it when they check it. I'm going to go ahead and delete that. Okay. And I'm going to, if you want to refill, then you can go here and hit refill, and you do have to search the patient every time. If you want to get to your messages, you can do that through clicking messages or through this box over here. Reports I've never used. Settings, you want to use those carefully because it does change the settings for the entire practice. And for the appointment schedule, I will show you that once I comply with HIPAA and do this on a weekend or something where you don't see patient information.